Hello and welcome to this talk about yoga therapy and Rolf structural integration, looking at ways of working with lower back pain. I'll be your host for this series. My name is Andrew. Hello out there. I'm a certified yoga therapist. I'm a certified Rolfer, a board certified structural integrator, and a lot more. Initially, what we're going to talk about is yoga therapy and how it's slightly different than the term yoga. And we're also going to look at Rolfing or structural integration and how the principles of that work together with yoga therapy and how they can offer other ways of looking at what's going on in our backs so that we can work with getting rid of this back pain that's kind of annoying, right? So the first thing I was asked to talk about is, what separates yoga from yoga therapy? And besides a semantical difference or a wording difference, one of the main differences is that yoga has come to be known as these group of exercises that people do, and that's it. This calisthenic routine. Maybe some people know that there's a meditation involved. Maybe some other people know about some breath work. Occasionally, some people know about these texts called the Yoga Sutras, which is one way of codifying what yoga is or was in the 400s when it was developed by a guy named Patanjali or recodified then. But that doesn't really necessarily say what yoga is for a lot of people. And so it's become this catch-all term which things fall into. And it doesn't necessarily give enough of a description or helpful. So the yoga therapy is a much more broader term. It's a scope of practice that came out of a lot of the yoga that we just mentioned and really wanted to refine it down and actually have principles a part of it so that people who were offering yoga therapy could have a unique language of which they were talking with, of working with people. So while yoga itself may mean many different things, yoga therapy has more definitiveness to it. And yoga therapy starts to look at what is a human being living in this world and having tools of working with it. So some of those tools similarly might be breathing and breath work, but yoga therapy starts to look at clinical trials and seeing, okay, when to use various breath works to help remedy issues or add therapy for people. So some things that are different about yoga therapy is, again, there's more of a clinical basis through it. There's also the sense of what is sometimes called a holistic property, of really looking at the whole being. So we're not just looking at these physical movements, we're really looking at the core sense of beingness, of which there's a body and a mind and maybe a spiritualness, if that's your cup of tea. So within yoga therapy, we have a set of tools that we learn. Again, I've mentioned breathing. Some might be visualizations, understanding neuroscience and ways of working with that and using visualizations of ways of what is sometimes called biohacking. The postures that most people know about are a part of it, but we start to look at, well, when to use what posture and how. So there might be a more biomechanical approach to it. The biomechanics would say sort of how the muscles, what is their movement patterns, what is their length, how do they work. Other parts of the world might call this kinesiology, which is looking at the science of movement, right? And so how are muscles or tendons or bones, how is the soft tissue structure working within the body? This can be very helpful for more physical injuries, although maybe less helpful for people dealing with anxiety and ADHD and these other aspects. This is where some of the breath work and or looking at the neuroscience comes into play, starting to understand what are the general causes and reasons for some of these happenings and what are ways that we can work with that, of which meditation generally is a base for most of this, and looking at how meditation can be helpful for working with issues, including back pain, which we'll see a little bit in one of the videos, but that will be something, if you're interested, that's a little more complex and we have time for, you're welcome to have direct contact with me and I can explain more. But for now, we have a limited amount of time and that is something that maybe is a little further along. So we're going to stick to more of the biomechanics, a little more of the physicalness, and just a little bit more non-physicality or metaphysicality. Structural integration, or Rolfing, is another principle-based practice that's looking again at the whole body, but in a slightly different way, looking at what is sometimes called biotensegrity models, looking at how the muscles are in relation with each other, have this whole webbing of support, and looking at how the body moves, how the body is held in space, what is the posture, and seeing all of these markers and working with that to find out, okay, well, we have a symptom, in this case back pain, what may it be from, and looking at the whole structure, because in this tensegrity model, we might see how tension in the calf, or the lower leg, is actually caused from tension in the jaw, with a tensioning up, as you might see if I pull my shirt here, it stretches everywhere else. So I might feel tension over here, but the root cause is not here. This is just symptomatic of something else. That's a little bit more of a base of the structural integration component. And we're going to look at some exercises that are marrying both of these together to see what are some ways that we can help get rid of back pain that you're dealing with to make your life more functional. The first exercise we're going to work with is actually going to be all about breathing. And I'll get into a little more in that video, but part of the reason we're going to get all about breathing is that our breath is very important for showing us both our psychological patterns based on how our nervous system functions, but also the physiological patterns. Because if we're not able to take big breaths, that's showing us that something in this whole structure is not there. And sometimes just by doing a few different special breathing exercises, we're able to relax some muscles that are subconsciously held that are actually pulling into that low back area. And we'll see how the ribs are related to our breath, and the ribs are also related to the low back via the structure. So the first part will be about working with our breath. The next few exercises will be a little more about looking at how the structure and the movement models of the lower back are. And by doing these really simple, or sometimes called somatic exercises, by doing that, we'll start to hopefully be able to find more space and freedom within the structure and ideally help to get rid of some of that back pain. So this is all a lot of words. It's what the intros usually are. We're going to next hop into the videos and start to see how can these possibilities help with our back pain. Talk to you soon.